I want to talk about something that's crazy. What's crazy is the crazies not doing the crazy stuff. Meaning that people with mental illnesses sound dangerous. We've been programmed to think they are serious dangerous. Or work in a situation where they appear to be dangerous. And like, everybody love a villain. You know, the Joker, you got the Thanos snap his finger, everybody disappear. Got the Night Ranger, Son of Sam. All those people appear to have mental illness, or they use mental illness as an excuse. But reality is, most people with mental illness, they are not producing the large amount of violent crime as the news and the media appear. It's all in our head. We suspect somebody to be really deranged or lunatic when you see something crazy or deranged, lunatikish on the news. But that's simply not true. In fact, if you do the numbers, you're talking about maybe 3, I'll give you 4, hell, I'll give you 5. 5% of the most violent crimes are committed by people with mental illnesses. And I'm talking about the people with schizophrenia and bipolar and the whole host of mental illness. The research says that it's not happening, only 5%. So if you take all the 5% away, that still leave you with 95% of the average Joes. The neighbor next door to you who might unalive his wife and kids. The dude who working at the post office just all of a sudden would post them. I'm not saying that something was never wrong with them. I said that most of them never set foot inside a mental hospital. And my fellow nurses, I'm going to say something, I'm going on a limb. Working on a locked facility unit, psych unit, is more safer than working in the ER, mid-surge, in those areas. Now L&D, because them babies ain't gonna come out and kick your butt. Because you don't know what you're getting. You get a patient in the ER, you don't know what his history is, you know what's going on, but a patient can be a screaming psychopath, very dangerous. You don't know what's going on with this patient. In mid-surge, the patient might have diabetes, but the patient might got out of jail for doing a 20-year stint for unaliving a person. Y'all don't know what you're getting. In psych, we know what we're getting. We get report. Dude was chasing father with a knife. Dude pooped on his neighbor front lawn. Dude have a history of violence. The dude said he's homicidal before he came to the hospital. Dude came in wrestling with the cops, took the ER. They gave him some medication, he's sleeping for 2 days, then they bring him up to me, Mr. Steve. I might be saying something that's shocking you, but I know psych. I'm not a psychiatrist, but I'm there. That's why I'm here, I'm talking to you about it. Because a lot of people got it misunderstood. They think because a person has mental illness, it's equal to violence, when that's just the opposite. They most likely be the prey. Because if you're homeless, because you got mental illness, that's dangerous. You be preyed on. If you're some kid in a group home, you're a target. You most likely could be a prey. If you've been in and out of institution all your life, of course you have to build up a tough persona. You might have to fight a little bit if you're a teenager to prove that you're tough so you won't be taken advantage of. Most likely be a prey. If you intellectually challenged, most likely to be a prey. People take advantage of you, especially if you're a good-looking young woman. If you're a smart young man and you got some amazing ideals, then some slick salesman comes to sweep your ideal right up underneath your feet. Or you getting a check every month before your mental illness, and a group home just comes snatch it up. Lifetime tenant. They can give you the bare minimum, but they got a roof on your head because nobody else want to deal with you. They give you a medication, barely getting you food. I'm not saying that all group homes and people who adopt children are predators. I'm just saying this as an example. Most people with mental illness are not violent. Even though I work on a psych hospital, I've been swung on, spit on, kicked, pushed, wrestled down to the ground, all that stuff. I even know a doctor who had got deleted by a patient. But what I'm saying is, if you're a nurse, get floated to the psych ward, you got your antennas up, that's good. But you should have your antennas up always as a nurse. Nurses are victims of violence. It's kind of common now. So I tried around the country and realized some facilities are good facilities, some facilities are bad facilities. I worked in facilities where they had good security. They had violent people, they had true security with their patient until their patient calmed down. Then they would go down to one. Then when the patient get the medications in him because he just went off his meds because he couldn't afford it, because he may be homeless. Now the nurses can take care of the patient, giving them proper care for his medication adjustment. Then I worked at a hospital where it was just a free pair. It was like the patient ran the unit. We had gangs in there. The nurse was walking on eggshells. She had to make deal with the patient. Hey, dude, y'all calm down. I'm getting you extra snacks. So they got good facilities and very, very bad facilities. But if you're a nurse, you go in a bad facility, you got to make a business decision. You had to go to another facility. That's just the way it is. Because a lot of facilities are getting nurses hurt and staff hurt because they want to cut down staffing. And the unbeliever at this, because one therapist got mad at me one time when I told her this, and when I told her, hey, this is not a good facility, I didn't create this chaos. I had to make sure myself is safe and my patient is safe. That's all I can do. The patient tying up walls or equipment, kicking on doors, I don't care about that stuff that's not alive. I have to make sure the patients are safe, the staff is safe, and everybody go home safely. Even the patient who be kicking on the door, because that patient need help also. So tell all your friends that Mr. Steve said that because you got schizophrenia doesn't mean you're violent. Because you got bipolar, that don't constitute you go slapping somebody around. Because most people with bipolar doesn't have the violent tendencies. People need to worry about the people that's not in the mental institution, who deny the issues, who have not got in contact with a shadow. Check out Carl Jung, the shadow work. Do shadow work. I knew my shadow. Those are the people you see on the news. One day, normal teacher. Next day, locked up forever because they did the unthinkable. That's about it, guys. But if you don't believe what I'm saying, run the numbers. Run the numbers and see what I'm talking about. Run it. You prove me wrong in the comments. You can prove me wrong, but I'm not wrong because I'm a mental health professional. That's what I did, deuces.